Ready? Hello again. I'm here to talk about heartworms tonight from Bentley Animal Hospital. Christine is videotaping, and Dr. Reiter, that would be me, is going to go ahead and go over things with you. I may have to look at a few things and make sure we cover things. We got a lot to talk about, so this is a very exciting. It's a very old disease, but it's been around for a while, and we'll start out by just kind of talking about what it is. Heartworms are basically a parasite, a worm that ends up as an adult in the heart vascular system of both cats and dogs. It's more known to be effective in dogs because they're more affected by it. We have foxes, coyotes, and wolves. They all carry the parasite, and it passes on to the dog because they're so well related, much easier. So they tend to get a very large infestation, which we'll talk about, versus cats, which usually only get 3 to 10. Most commonly 6 is all they get because their immune system is a lot better, and they just don't. They're more of a dead end host for them. They don't carry them just like the dogs do. So dogs can get as much as 60 in a heart, and these worms literally, if you can see this heart here, I'll take it out, but this heart has been here at Bentley Animal Hospital thanks to Dr. Mike Jones for probably over 20 years. This dog passed away from heartworms, and I used to work down in southern Missouri, and I'd have 5 positive cases a year, treated over 100 a year, and this is literally basically exactly what they look like. These things get into the heart, they get into the lungs. Trying to get it out of here. But as you can see, this is the ventricles, and these are worms that are clogging, going from side to side. They come out of the ventricles, and look at that. They go up into the aorta, into the lungs, and that is what causes the disease. So this is not only the heart, but it also it covers the blood pressure, the kidneys, the lungs. So this is so important, and it's so, it's easily prevented. It's very difficult to treat and can be very deadly. So, but clinical signs. Let's talk about clinical signs. So what would make me think that my dog had heartworms? Well, first of all, the biggest thing is I don't want you to come with me with clinical signs, because you can give medicine every month to prevent this. And even if they do get by the prevention, so we found out some preventions have resistance. These mosquitoes, their larvae that they're carrying for heartworms, are getting resistant to not just one product, but all the products. So it's important, though, if they even do get by that, if you test your pet every year, your dogs every year, if you catch it early, that's when it's treatable. So many times, whenever my first year out of school, where I worked in Sikeston, Missouri, and I had very many, treating over 100 a year, I'd have people that bring their pets in and lay them on my table, and they were pretty much comatose, laying on their side, difficulty breathing, fatigue, dying, and they could say, "Can you help my dog?" "Yes, I can put it to sleep." I don't like to tell them that, so if they just would have used preventatives, they could have kept away from doing that, so prevention is the key, if you haven't heard, and especially for cats. So, but especially dogs, weight loss, lethargy, coughing, exercise intolerance, those are the clinical signs, death, seizures. I mean, it can be so many different things, but really exercise intolerance and coughing are probably the 2 most important. And exercise intolerance is that, a 2-year-old dog that, running around and just doesn't have the energy it does. That's the thing. But, it's easy now. We're intelligent enough to know that testing them once a year is easy. And there's some people that don't want to test their animals. Why don't you want to test your animals? I keep it on preventative. It's supposed to work. Well, you just heard me say that not all preventatives are 100%. So please test your dog every year. And even the manufacturer of, let's say HeartGuard, the manufacturer's HeartGuard, they recommend yearly testing. The American Heartworm Society, where we put a link on our website about heartworms, please look at that. They'll tell you, we recommend yearly testing, whether you keep your animal on preventative or not. That is not cats, guys, all right? The tests for cats don't work very well. The antigen and the antibody test. So, and ultrasounds and x-rays, that's what we do for cats. So cats respond totally different than dogs. So dogs, these antibody tests that we do in the office that are quick snap tests, or we can send them out to a lab and have it done. they're 95 to 99% effective. If they're positive, we'll usually run another test. Before I get away with testing, let's talk about so we talked about the dog's clinical signs. The cat's clinical signs would be signs of asthma, bronchitis, trouble breathing, those kind of things. And it can go all the way to death and everything like that. But the same mosquito, the Culex mosquito, is the one. That's how this disease is spread. It grabs it from another dog by taking a blood meal. It takes that blood, it becomes an infective larvae, and then they inject it into a cat or dog. And that's when it can be killed in that immature infective larval stage. Once it's molted for 2 or 4 weeks and it gets as an immature adult, it can't be killed by this medications anymore, no more. At that point, then you're to treatment. And we'll talk about treatment in a little bit. But especially for the cat, there's no good treatment. They only get 3-6 worms. And most of the time, they are a male infestation, and that's why it's hard to diagnose it in a cat. Since we'll go on to when to test them, so cats, we don't usually test a cat unless they're clinical and we suspect it. That's why we recommend prevention more in the cat, because our antibody tests, our antigen test, your X-rays, your ultrasound, all that stuff is not very sensitive. And if you get a negative test, your cat can still have it. So a positive test does it on some of these don't even mean it is, because bronchitis and, or having asthma is a thing. So asthma and heartworms can mimic each other. So it's very difficult, guys, for us to diagnose, and it's very important to get cats on prevention because it's out there. They're dying of things, and we just don't know it until you do a necropsy. And that's where they find it a lot of times. So when they test your dog, you should test them every year. We've already talked about that. And so if you start a dog on, I'm trying to figure out where I'm going to go next year, but basically if you start a dog before they're 7 months of age, you don't need to test them. A cat and a dog should be on heartworm preventative by the time they're 8 weeks of age. So 8 weeks of age is when they recommend the American Heartworm Society. And a lot of this stuff, and I may not talk about every point, but it's on that website that I sent about heartworms if you guys want to get more in detail. So what happens if they're positive? So let's talk about the dog. So let's say I get a dog and I test them, his blood, we draw blood from their arm or their neck, and we do this every year. And if they become positive, then we send a second test off to retest it. So it's just because we want to make sure 100% that we feel that the dog has it. Most of those tests do not lie, guys. I'll tell you that. Every one that we've suspected, almost every one of them we've treated. So once you do that and they come back and you're sure they're positive, the next thing we're going to do is look at doing x-rays, doing blood work, during urinalysis. And the reason we do these tests is we're staging a dog. We want to know if they go anywhere from a stage 1 to a stage 4. And that's all dependent on history, clinical signs, and blood work and x-rays. So stage 1 and 2 dogs, like a lot of those dogs that are non-clinical, you can do an injection of melarsoline. That's imiticide, a product by Marielle. Yes, it's arsenic. So it's come a long way. If you catch it early and there's no clinical signs, I have very good success rate, very, very good success rate with that, where they don't die. Like I told you, there's been a lot of dogs that I've done necropsy on my first year out of school, dogs that were just too far gone. If you see clinical signs, your dog's in bad shape. So that's why you test them every year. We do not want them getting to the point where they're actually showing disease, the reluctance to move around, or getting tired on a walk like they didn't do before. So when you start to see those things, I like it when they test positive and the owner says, well, I don't notice anything. That's perfect. That's what we like. So they're an easy candidate to treat. Biggest side effect, let's say we do, we set these treatments up, and a lot of these treatments are we either do one shot 24 hours apart, or we can do a one shot, wait a month, give 2 other injections. There are some other things. We do put them on doxycycline because of a bacteria they found out in recent years that it's associated with the heartworms. It just makes it easier to kill the heartworms and things like that. So there's some kind of symbiotic relationship between the two. The cats, treating them, guys, usually you just treat the symptoms. The injection you can't use it in the cats. So we'll treat them with prednisone, antibiotics, things like that, but there's, like we said, the most important thing to a cat is prevention. If they get it, you cannot treat them. You're just treating symptoms until their body gets rid of it, because I think the average life expectancy is 3 years on a heartworm adult and a cat, because their immune system gets rid of it, and that's why you get asthma signs, because it's around, like you saw in that model, they're in the lungs too. So, and the necropsies that I've done, I can tell you that when you kill these things, you try to kill them to the point, and you have this exercise restriction when you do this. It's very important because it kills the adult heartworms, that imiticide or that melarsoline. It kills the adult, and the adults, you know, I've seen wads of them get lodged up in the vasculature of the lungs and cause an embolism, and then that's what they die from. Basically, they die from lack of blood flow. So, and I've necropsied pets and have seen this, and it's very nasty and ugly. So that little heart that I showed you isn't near the amount of worms I've seen, you know. So let's talk about, so we talked a little bit about treatment. We talked about staging it with the tests. Also important in treatment, you know, we talked about keeping them quiet. That's very important. You know, we do that for almost 2 months. So while we're doing it. And how does a heartworm preventative work? So I have a few, you know, I have heartworm preventative for cats. I like the Revolution. There's all kinds of products, guys. There's so many products that flood the market, it's ridiculous. You know, I use the HeartGuard, which you're seeing in the dogs. I do have Trifexis, you know, that is another product that, you know, these are monthly. They do have 6-month injections. I don't use it. I don't like giving something to last 6 months in my pet. I wouldn't do it to my own pet, you know, so... But I use the Revolution for the cats, and I use HeartGuard. You know, I mean, HeartGuard, NextGuard is what I use on my own pet. So, and that's what I use on my clients' pets, unless they like Frontline. We do use that for gold, for flea and tick. But the HeartGuard, give it every month. You know, and they got reminders. You can, you know, how can I remember to give it? I use my phone. You got to use what works in your life. You know, I use my phone. It reminds me, and I don't swipe that alert away until I give it. So, and one thing I want to tell you guys, so one of the big things is everybody says, well, you know, I live in Minnesota, let's say, you know, I don't need to give heartworm preventive. Well, they have found heartworms in every single county in a dog in Minnesota now. So, and yes, warmth and mosquitoes being out definitely control how prevalent it is in your area. And I think above Tennessee, I believe reading there was 6 months of an infective months that they believe that heartworms can be infected. But you got to remember, these adults will get in the ground and these adult mosquitoes, and they'll have infective larvae in them as soon as it warms up. Like in Missouri, you know, we all know, we live here, you know, it becomes 70 degrees one day and it's 20 the next. When it warms up, mosquitoes come out. So it's easier just to do it once a month and stay on a routine. So I won't go any farther on that. Another thing you need to remember, these heartworm preventions, most of them have dewormers, and your pets are getting wormed for hookworms, whipworms, roundworms, things like that. You know, so these heartworm preventatives, don't forget, your dog is out there sniffing on the ground or licking in puddles. They're getting other parasites, intestinal parasites. So please remember to give your medications, not only for heartworms, but remember they also do it internal parasites that get into the intestines. And some of these, you know, intestinal parasites, they're zoonotic to people. So that means we can get them. And it's more your kids or your nieces and nephews. So what else to talk about? The Revolution in cats. You know, again, it's so important to keep cats on preventatives because you can't treat them, guys. And the testing, as you heard earlier, the testing is horrible. We don't have good tests for these cats. So please, prevention is the key. Please share this video. Before I get done, I'm about ready to wrap it up. I do have a little, this was a thing I printed off that American Heartworm Society. If you guys just want to see, you know, how it's spread, it shows your, you know, a dog getting bit by, or a cat getting blood taken from a mosquito, the infective larvae getting passed into the cat or dog, and at what stages they can be killed and not killed. There's a very short time period. And this preventative works on a, if a dog gets injected with or a cat, if they get injected a infective larvae into them, it actually kills it from the month before. So it doesn't kill it immediately. So when you stop, if you stop your preventative in November, remember October is when you stopped it, because if mosquitoes were out there in October, that's when you actually stopped your medication. So it's just so crazy just to even stop it, guys, because it's you know, we know a lot more than you think, and you know just give it every month. So I'm done on my soapbox. So I'll take some questions. I'll answer them the best I can. You know, different products. You know, I can talk to you about products whatever you guys want to do. I don't know all of them. There's so many, it's ridiculous. So if there's any questions, let's take them now. I'll wait here. So, while we're waiting, if your dog, let's say your dog comes up off heartworm meds, let's say you miss a month or you miss 2 months, continue to give your medication, right? That's the most important thing. And then test them 6 months later. So they won't be positive right away. So there's no reason. We used to test them right away and then put them right back on. It's better just to keep them on preventative. It's changed, guys. Keep them on preventative, retest them in 6 months, and just keep doing it once a year after that. So.
Betty Scott wants to know if the cat Revolution tastes good to the cat.
All right, good question. That's a topical. The Revolution is a topical. It's not given orally. They do have, I think Oral Heart Guard is still out there for cats. I use a Revolution, Betty Scott, just because, like I said, it prevents ear mites. I didn't tell you that, but it prevents heartworms, hookworms, roundworms, ear mites. What else is the other thing in heartworms? So it covers a lot more things than just an oral. So that's why I choose that. That's why I use Revolution. But it's a once a month topical. You put it from the shoulder blades up, right on the skin, and it absorbs into them. So good question. I forgot to say that was not oral. So told you I'd forget. So any more questions? I'll give it about 30 more seconds.
Do you want to talk about the rebate?
Oh yeah, there is. So like for your pets on Heart Guard, Next Guard, you can see we kind of put it up there so people would know. But if you buy a year's supply of Heart Guard and 6 months of Next Guard, or excuse me, a year of each, you get $50 off. And then and this is something they run most of the year, and they do redo things every year. And then like the Heart Guard Frontline 12 and 12, they do 25, I think is what they do. I can't keep track of it, guys. So, but there are discounts. But the most important thing is just use it. So, all right, I'm done. I'll see you in a couple weeks. We'll do something else. Thanks for your time. Pass it on, please, please, please. The pets need us. Thanks.